talk about is a platform, a little bit different, but it kind of plays on to what Dr. Turner was talking about. And that's a way to make life easier, create real value for both the surgeon and the patient with a forward-facing IT platform. Mike and I are both developers and equity partners in this company. And so believe us when there's some bias that's going to be involved with this presentation.
I think all of us have faced the challenges with EMR implementation over the last few years. Everything from the meaningful use guidelines associated with the Affordable Care Act to ICD-10 implementation, the use of Epic, Athena, Allscripts, all of the various IT models that have dominated our inpatient care, and largely none of them have helped us nor helped our patients. And I think the IT vendors have dominated this space. It's resulted in many changes with BCPI, CCJR, inpatient code changes, and just sort of a one-way valve of us inputting information into the EMR at the hospital and various facilities where, federal regulations, things that are designed to help overall healthcare have aimed to help us and our patients, but have largely resulted in no benefit. If you could advance, you'll see one of the ICD-10 codes that you can see. I don't always get sucked into a jet engine, but when I do, I use this ICD-10 code. So largely all of us that treat hip and knee arthritis use only a handful of codes. And you got this real life code of getting sucked into a jet engine, which really has no influence on our ability to treat patients, get data for ourselves, understand how our patients are doing after the operation, track outcomes or the like. And so we've sought to maybe develop a software platform that really creates value for us and our patients. If you could go forward. So we've been using a software platform called PRO-MAPP. Go ahead. And it has largely been a response to the EMR dysfunction, where it's a one-way track of us inserting information into the hospital EMR. We can't get the information out. We can't do any research or meaningful understanding of our patient outcomes. So we developed a system that develops patient-reported outcome measures, such as a patient tablet, as you can see here. It's customizable and brandable, that includes our surgeon practice and individual surgeon logo. We found that if the surgeon is reaching out to the patient, that the response rates go up significantly. And I think it develops a further connection of the surgeon to the patient, which I think is important for all of us. Go ahead. Developing a relationship that the patients experience at their facility during their surgical care episode and their satisfaction associated with the episode is very important. We've developed really any score that you want to put out to your patients in terms of net promoter score, which I think is a simple aggregate. Would you recommend this surgeon for further care for their hip and knee is an important thing to understand, along with individual responses to their care at the center, everything from parking to the way their family was treated, to information, to signage. I think it's an interesting thing. If you push the information to the patients for them to answer, you can really be in a cycle of improving your system. If you could go ahead. Interestingly, all of our operative reports are largely standardized, so I don't dictate any more of my primary or revision knee replacements. They're done day of surgery. They're faxed to both the billing office and our facility, entered into the patient chart within a number of seconds. So there's no follow-up from the hospital telling me I missed certain dictations. They're all done, signed with a Medicare compliant signature within seconds of finishing the operation. Go ahead. We scan the implant for both the barcode and the lot number at the time of the operation. This develops a prospective implant surveillance registry. Go ahead. The interesting thing, and Keith will comment about this, the time to submission of the claim time to reimbursement to both the practice and the facility with an automated system for the hip and knee replacement surgeon has been really revolutionary for both us and for our facility in terms of AR, time to, submission of the claim, and then time to billing and time to collection of the services. Outcome reporting, we have PRO-MAPPs, both pre-op, post-op, and any time interval you want after the operation. Go ahead. And then importantly, long-term implant surveillance for any of the implant manufacturing vendors or any of us to be able to develop a multi-site database for the outcomes from our procedures are very important. And importantly for me, it saves time the day of the procedure to where I walk out after 8 or 10 joints mid-afternoon with all of my work completed. Go ahead. I think overall, what has it done for us is indeed resulted in a solution that saves time and increases revenue, which is highly accurate for both the surgery center staff, for the hospital staff. It identifies an implant surveillance database and all accreditation things such as the AJRR are met through this system. And the famous philosopher, my brother Keith, has said implementation of PRO-MAPP has reduced time from service to posting, and billing charges have been reduced 75% and 68% respectively. And most importantly, our overall time in AR was reduced significantly to collecting the money in less than a month. So I think for all of us that are interested in the influence of time on running a private practice or running an academic practice, saving FTEs, investing that money back in the program, as you heard earlier, whether it's through a service line or through where you own the enterprise, are all very important savings and value creation that we've seen through PRO-MAPP. Go ahead. I'll turn this over to Keith to take it from here.
So thanks, Mike, and thanks, Mike Morris. So there's three real aspects to the platform. The first is the patient-facing platform. So pre-surgery communication is all done by email. The patients register by email. If they don't have email, if they don't register, they register upon arriving to the facility, whether that's at the hospital or at the surgery center. We collect PROMS data the day of the procedure, and then at regular intervals, 6 months, 1 year, and yearly intervals afterwards, through email or other communication that the patients can select. We look at satisfaction data, which is critically important for our surgery center. It is all customized and branded for the surgeon, the practice. It includes a headshot. It's an email from me, so they're not receiving a strange email from some unknown address. It says, your Dr. Keith Berend sending you an email. We'd like you to fill out this form. They can quickly do it online. It loads immediately into the PRO-MAPP platform. And so the patient feels connected to the surgeon from a patient-facing interface. It's not paperwork. It's not extra work for them. It's a very friendly thing that comes to them. Next slide. It's a surgeon platform. And Mike was talking about this. I'm going to show you a brief video. There's tailored operative reports, meaning no more dictation. You scan the implant. You integrate the implant into the operative report. You can take photographs if there's something that needs to be photographed. It results in significant time savings, but more importantly, accuracy and efficiency in the standpoint of you're dictating, you say 54 instead of 56. The implant record, the actual sticker, the lot number and part number from the sticker is implemented into the operative report instantaneously. Next slide, please. And then from the facility standpoint, whether it's at the hospital or at the ambulatory surgery center, it is instantaneous billing. So the operation is immediately coded. It's coded with absolute perfection in terms of compliance because you have created the operative report that literally says exactly all of the variables that need to be stated in order to accurately code for that operation. It gives you outcomes. Again, you've got your PROMs, you've got implant surveillance, so you can follow different procedures, different implants. You also have your PROMs at pre-op, 6 months, 1 year, and yearly afterwards. Accreditation reporting, we've just joined ACJR. And it was very simple for us to have added one variable to our little template you see on the iPad there about something they ask about anesthesia. We added one little bubble. You tap that and we were ACJR compliant. It allows for clinical research because you own the data. So that data comes back to you in any form that you want it. And then you're future-proof because you actually own all this data. You've collected all the part numbers, you've collected all the patient information, you've collected all the PROMs, you collected all the operative reports, and it's sent instantaneously to whatever platform you want it to be sent to. And so we believe that it's future-proofs you against whatever's going to come down the road from the administration. So here's a quick video on how it works. I'm going to log in on my phone. You're doing a total, a medial partial, a lateral, a revision, an ACL, a knee scope, whatever surgery you want to do. You have your templates pre-loaded into this. You choose your diagnoses. You quickly click on some of the buttons here. And then you go through and basically you click on all these buttons, and all of these buttons are variables that you insert for your practice to customize your operative report. Then you go and scan the labels. And as you scan through, it gives you your barcode. It gives all your labels. And so there's no more searching for labels. All the details are correct. We complete the operative report. You can review it if you want, but basically all the areas in blue are variables that you get to fill out. Everything in black are preset dictation that you fill in ahead of time with the company, and then you hit complete. And as soon as you hit complete, it is faxed, emailed, or electronically transferred to medical records, billing, research, primary care doc, wherever you want it to go to. And so it's an incredibly efficient thing. It takes you about 40 seconds per patient, and you're done with billing, you're done with research, you're done with corresponding with primary care. The patient can receive it if you want them to. So since we launched this in September of 2017, we've done over 15,000 procedures in patients. We've had over 45,000 implants that are logged into the system that are being recorded. At White Fence Surgical Suites, we heard earlier about some numbers. In August, we're thinking it'll be around August 3rd or August 4th. We will have done 10,000 outpatient joint replacements at our freestanding ambulatory surgery center in early August. And that started in 2013. In 2017, we started with this platform. We save over $3,000 a month on dictations alone. And so coming up on 10,000 joints, having all that data, having all that information is incredibly valuable. It's incredibly efficient, and it saves time, and it creates value for both the surgeon and for the patient and for the healthcare system as a whole. Mikey?
Yeah, so I think when you look at the overall value, you look at your overall pathway of care and all the things that need to happen associated with, the patient care, their surgery, their recovery, the billing, ongoing feedback care, and, overall accreditation or any kind of, overall activities associated with your center, your practice. There's a number of activities and costs. You may pay for some of them, as people talk about who pays for the PA and Hawker's co-management agreement, or who pays for the thing in the academic setting. In the private world, we're really interested in who is paying for what and what value creation do we get from that. Go ahead. And it's interesting, go ahead. If you look at what the system creates, one more, instead of an entire thing that takes 1 or 2 weeks, if you have an automatic system that takes under a minute, that accomplishes all of these activities, is highly accurate. Both the administration, the folks that submit our claims are all involved in this process. And it's really developed a value creation or an efficiency in my day that the streamlined workflow really has produced significant value. Unlike the various EMR systems where they're highly difficult to change. They're controlled by the large IT vendors, be it Epic or Athena. We control all this data. We can pull the data anytime we want and look in either PROMs, outcome measures, compare unit to total, compare multi-site implant registry data. And I think the data utility for the surgeon and for the patient is incredible. We found response rates compared to our paper system at 30% are significantly increased with the digital platform, over 80% at every time frame. Go ahead. So I think in summary, this IT system has developed easier collection of quality data. It's helped us engage our patients, everything from pre-op proms to post-op proms, feedback on their center experience. It certainly helped my day in terms of operative reports, begun prospective implant tracking the day of the operation. It's improved workflow. It's eliminated FTE and cost. It's reduced our AR over 75%, which has been significant for our private practice. You owning the data as a surgeon or an implant vendor has been a high value for us. It's helped with our research submissions, both to AAHKS and the various societies that we're involved in. We've used this data in negotiation with Anthem and other large payers around the country where we have all of the things they want, which are implant variables, PROMs, outcome variables that help us be a leg up compared to our competitors. And overall, it's helped our life be significantly easier. Go ahead. So thank you very much to the foundation for allowing us to present another thing in terms of efficient orthopedic care in the hip and knee space. And I think everything from the operation to the post-operative op note to data collection are all important variables that we're very concerned about. Thank you.